More people die of lung cancer than breast, colon, and prostate cancers combined. New surgical techniques are being developed that require shorter hospitalizations and speed recovery. Dr. Jonathan Waxman of Boca Raton Regional Hospital joins us to answer your questions about minimally invasive surgical techniques for lung cancer. Thank you so much for joining us.
Pleasure to be here.
Okay, so when someone is diagnosed with lung cancer, what are their options?
Well, they can be offered either surgery and sometimes a combination of either radiation or chemotherapy.
Now, if they do decide to undergo surgery, is it a requirement that they do chemo or radiation, or can any of these stand alone?
They can be standalone or a combination of these.
So what do you look for to determine what sort of combination you'll give?
We look at the size of the tumor, its location, and how localized or how widespread the tumor is.
Okay, and as we mentioned, there are some minimally invasive options. What are some of those choices patients have now?
One technique we have available is VATS surgery, that stands for video-assisted thoracoscopic surgery.
Okay.
Other technique is robotic surgery as well.
Okay, and how do those work?
Well, by means of small incisions, a part of the lung is removed, and we avoid rib spreading, which causes a lot of pain.
And that's one of the procedures. What about the other? How does that work?
Well, the robotic procedure is very similar. However, by the use of robotic techniques and technologies, it allows for better visualization.
Okay, and what are the benefits of getting the minimally invasive procedure rather than getting full-blown surgery?
Well, by using small incisions, the patients have less pain, they have a speedy recovery, they can get back to their usual activities faster, and if they need additional treatments, they can get them at a faster speed.
Now, are all of the minimally invasive options a possibility for all lung cancer patients, or does it kind of depend?
It depends on the patient and on the tumor, the location, so every treatment has to be tailored to every patient.
Okay, and what else do you think that patients should know about the options if they've been diagnosed with lung cancer?
Well, they should do their research, and they need to undergo treatment by trained physicians in minimally invasive surgical techniques.
Okay, thank you so much for joining us. We really appreciate you being here. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.